Okay, we're recording now. So the chapters that you're going to be responsible for from edition 6 are 2, 3, 9, 23, 20, 21, 22, and 31. Okay. Do you want me to convert those for you and tell you where they came from? Because that's what's on the top of the study guide. Let me share my screen. Okay. So you see right here where it says chapters 1 through 3, right? That is now chapters 2 and 3. That's it. There's no 1 in your 6th edition. Okay. Does that make sense? I don't want to confuse you more. Okay. Chapter 3 stayed the same, changing U.S. public healthcare systems. Evidence-based practice is chapter 9. Okay. Vulnerability and vulnerable populations is chapter 23. Family development and family nursing assessment is chapter 20. Family health risks is chapter 21. Health risks across the lifespan is chapter 22. And school nurse didn't change, it's chapter 31. Okay. Anybody have any questions about that? I want to give you the correct chapters from edition 6. Okay, the chapter headings are the same. So for we are teaching and doing this exam review from from edition 6. Okay, I need everybody, I'm going to stop sharing for a minute. I need everybody to turn their cameras on.
Let me see, wait, how do I do this?
Anybody have any questions about the chapters being covered? For those of you that are just coming in, please put your name in the chat along with your professor. Okay. Okay, so number of questions, 50. They're a combination of multiple choice, select all that apply, math problems. Has anybody been to any of the other reviews this week? Or is this your first one?
My first one.
Okay. Okay, everybody knows ExamSoft. I always tell my students they should double check with ExamSoft, make sure your account is set up and nothing's wrong with it. I'm going to be uploading, or we should be downloading exams for you to be able to download over the weekend, because the expectation is that you come to class with your exam downloaded, right? Everybody knows that, right? Okay. Questions in math, pretty simple questions. IV calculations, determining equivalence, converting between systems, and a few other things that are on here. I've sent out, I hope your other professors have too, I sent out a lot of math resources, handouts, practice tests, tutorials. So if you struggle with math, I would review those. Okay, you have case studies to look at. Okay. Case studies focus on concepts, right? Assessment and prioritization and management of care. Okay, we're always thinking safety first. Okay, what's the priority? What are the prevention levels? One of the expectations is that you're able to apply the primary, secondary, and tertiary to all the different topics we're covering. Okay, and same with ADPI. ADPI, we still use the nursing process. ADPI, in your clinicals, you use them, but we also we apply that to community. Okay. And then this is going to be Healthy People 2030. I can't change this, it's a PDF. So levels of prevention and Healthy People 2030 are in your 6th edition. That's what we're going with. We're not doing anything with Healthy People 2020. So we'll skip over the Healthy People 2020. There's a few paragraphs in here about that. Okay, but the expectation is that you review in all these chapters we just talked about your levels of prevention boxes and your healthy people 2030 boxes. Okay. Let's see. This is not an all-inclusive study guide. Best practice is to prepare for the unit exam is to review your notes, recordings. If you missed part of a lecture during weeks 1 or 2 because something was going on, I would highly suggest you go back and review that part of the recording that you missed. Readings, discussions that you've done, review the Zooms if you need to, and then attend as many of these as possible. You have the master schedule. I think there's maybe 2 more after me, and there's already been 2. And your instructors should be sharing those recordings with you. We already have 2 recordings, one from Dr. Ford and one from Professor Alani that I just shared with my class a little bit ago. Okay, and then after doing all that preparation, study guide, readings, reviews, if you're still having trouble understanding certain concepts or topics, reach out to your professor and get some tutoring. Okay. Anybody have any questions? Okay, so this is broken out. The study guide is broken out into sections. Okay, and they try to follow along with chapters, or at least the topics in the chapters. So for example, this is just a generic section, priority. Well, it goes through priority and safety assessments. So using ADPI safety delegation principles. Okay. The next is section is acts and organizations that play a role in public health. So that would be chapter in your 6th edition. That would be come from chapters 2 and 3. Okay, I'm going to go through these, but I'm just showing you how this is set up. Okay, management of care across the lifespan. Okay, that's going to be chapter 22. Health risks across the lifespan. School nursing is chapter 31. Family assessments and home visits. That's chapter 20. Vulnerable populations and health risks. That's going to be chapter 20, a combination of chapter 23 and 21. So I tell you this in case you are reading through these sections and you want to go back and review the information. I'm trying to be a little bit helpful to you so you don't have to go digging. I don't know if this is helpful, but hopefully it is. Evidence-based practice is chapter 9. So we're done teaching from edition 5. All the information I'm giving you is edition 6. Okay. And that's it. Okay, so we've covered all the chapters. And they all have their own little section in here. So let's review. I at least want to review. First of all, does anybody have any questions? Does anybody review the study guide and there are areas that you don't understand? Okay. Okay, so let's just quickly go through these. Each bullet is a different point about a different topic. And so, you know, if you have used this study guide and can articulate this study guide, you should do really good on the exam. It's a good representation of all the chapters and all the topics. It's a good summary. It's an excellent summary of everything we've covered over 2 weeks. Okay, so risk factors for SIDS, says it right here what it is. Prone, what are risk factors? Prone or sideline positions. I'm not going to read through this whole study guide. I want you guys to go through it as well, but just want to touch base on each bullet. Okay. interventions need to be based on goals of lifestyle changes for the entire family. So this is about family assessment. The goal is to modify the way the family eats, exercises, and plans daily activities. Okay, this review, ignore this third bullet. Okay, ignore the first sentence of it. Okay, let's look at the second part of it. Okay, look at violence, weapons, drug abuse, alcohol abuse, motor vehicle. Remember, these are leading causes of morbidity and mortality for adolescents. So know why, know your nursing intervention. So what this means is, please know what your leading causes of morbidity and mortality is for adolescents. Okay, like I said, ignore this part right here. Okay, we need to know this second part of it. Okay, safety assessments in the environment. Okay, things you should look for when assessing common areas and playgrounds. We, at my class, we went through the box on playground safety. What if you're a public health nurse and you're asked to participate in the development of a new recreation center that includes a playground? You're gonna need to be aware of how do you do a safety assessment for playgrounds? So go back and look at that if you don't know what that is. Okay. What would put a child at risk? What kinds of pavement should you use? What kinds of equipment should you use? Okay. Again, I'm going to ask you to ignore this here, this first sentence. Okay. How would a community nurse assess and teach families primary prevention principles with respect to two concepts? Okay. So we're talking safety now. So somebody answer that for me. How would a community nurse assess and teach families primary prevention levels? What would they do? Give me some examples of what they would do with regards to violence and safety. Pardon me?
Oh, violence and safety. Sorry.
That's
I
okay.
thought you were asking general. I was
Nope.
saying that it would be safe teaching, like if hello.
So yeah, I'm here. So
Oh.
I'll do some. Why don't you give me some primary preventions with regards to gun violence and safety? What would those be? What's primary prevention?
How to teach how to lock the gun, and we have to put it on in safe place. Also, lock place just in case kids they go and grab it and try to play with.
Yep, perfect. That's wonderful. That's excellent. Anybody else have anything else primary they would add? What about teaching families about the risks of having firearms in a home? Is that primary? Remember,
Yes,
primary
if
is
we are teaching without having.
pardon me?
I say yes, if we are teaching without happening.
Right. We're trying to prevent
Before,
things
right?
before they happen, right? We're trying to prevent things before they happen. That's what priority is. That's what primary is.
Yeah.
Okay.
Okay.
Tertiary. What's tertiary prevention?
When we are doing the treatment, when we are follow up with the patient with illness.
Yep.
And when. Yeah.
So they already have their condition or disease, and we're trying to help them manage it, right? We're trying to prevent any further complications or minimize the complications, but tertiary is treatment. We're already treating something. Okay, so tertiary prevention, how does this come into play when doing planning of care for children diagnosed with chronic condition? So what would we be doing as tertiary prevention interventions for a child with chronic condition? They already have it, so what are we doing?
With cardiac condition, you say?
Yeah, I'm on this bullet right here. Tertiary prevention. How does this come into play when planning care for child diagnosed with chronic conditions. What would some examples? So how would the community nurse, what recommendations would she make?
Well, depends of which illness the patient has. Like
Okay.
example, diabetic mellitus.
Okay,
So we're gonna assure that teach the families. I don't know if they need insulin. Teach them, and they can teach us back. We can talk to about dieting. We
Right.
can talk to about exercise that can help them to decrease. I mean, like, I don't know, trigger,
Mhm.
get worse.
Mhm. And I'm going to add to that. Thank you. That's awesome. I'm going to add to that too, is part of the assessment. The last part of this says, look at how the community nurse would make recommendations and assess interventions. So we also need to make sure that the parents are capable of caring for the child. For example, kids with chronic conditions may require lots of services, lots of treatments, right? We need to make sure that the parent is able to make appointments, keep appointments, get to appointments. So that's also part of our assessment, because we know that children with chronic illnesses require a lot of coordinated care. Okay. Let's see. Smoking and children diagnosed with chronic conditions. How would the community do primary and tertiary preventions? Think about ADPI, think about prioritization. So this is just having you think a little bit further along these lines. How would you create a nursing plan that addresses things like asthma, secondhand smoke? So we need to think about making sure we understand primary, secondary, and tertiary. When it comes to, like you said, we don't know what the condition is, but you have to be able to formulate those primary, secondary, and tertiary interventions depending on what the condition is. And then same with, what about kids that are exposed to secondhand smoke from secondhand, they're exposed to secondhand smoke and they have asthma. We have to be able to do primary, secondary, and tertiary interventions with them as well. And then review concepts regarding assessment and how health disparities play a role in your nursing process and health prognosis. What are health disparities? What are they? You need to know this. So what, anybody have any idea what health disparities are? What's a disparity?
Would it be like it puts you at risk for something? So your age, race, where you come from, economic status.
Yep. Access is big.
Access.
Yeah, right. You're at a disadvantage. Okay. It's pretty much what that means. You may be at a disadvantage. That's a health disparity. So how does that play a role in health? You know, maybe you're not getting primary care appointments. Maybe you're not getting early diagnosis of something, right? Maybe you're not getting the access that you need. Okay. And again, next bullet is understanding the difference between primary, secondary, and tertiary, right? Be able to distinguish between three and know examples of each. The one thing I always say is don't get caught up on the word education for primary, because it's not only primary, education is in secondary and education is in tertiary. Okay, so I know obviously primary prevention includes a lot of education, right? We're trying to prevent something before happening. We're talking to parents about obesity with their kids, about healthy diets, about asthma in a smoking home. It's all education. And actually community health nurses, a lot of what they do is education. But think about it. We do education. Just remember primary, yes, it's education, but it's more prevention. And prevention is going to take education. But think about secondary. We're screening. So I think if secondary is, yes, it's screening, but it's early identification, early intervention. So like screening for a mammogram. Okay, you're having a mammogram. Okay, that's secondary because it's a screening. But what are we trying to do? We're trying to do any kind of early identification, early treatment. So that's going to require education, right? Because something may be brewing with early identification, but then we rely on our education to hopefully make sure clients understand how to not let this progress. Like, for example, I was in school nursing for 20 years. We used to do obesity screening. Okay, so we'd identify kids who are at risk by screening, at risk for obesity. So we would step in and try and educate them that, hey, you're at risk and here's going to be the long-term effects of obesity, if you end up obese. Does that make sense? So education is in secondary, and then education is in tertiary as well, right? They already have a disease or they already have a condition. So let's say we're talking about teaching with diabetes, right? You're educating them on how to care for themselves with diabetes, right? You're educating, think of something else, seizures. Let's say people with seizures, you're educating them on how to manage their seizures. So that's my example of how education is at all three levels. So if you get a primary, secondary, tertiary question, which you will, there's several on each exam, okay? Don't focus on only on the word education. Okay. This last bullet, what you're going to have to go to chapter, because you're going to have to go through chapter 20. I think you'll be able to find this here. Preparing for a home visit. Okay, I think it's 20 or 21. Okay, there's a box in your book. Okay, and it's safety tips for home visits. Okay, really important. You need to know this. When preparing for a home visit, know your safety precautions, right? What do you need to do? Obtain an escort to walk back to your car. Safety is important. You need to sit between the client and the exit. There's about 8 tips. So you do need to know that box. Okay, because community health involves lots and lots of home visits. So we're heavily focused on safety. Safety comes first. Okay.
Professor, home care or hospice, they will be community health?
What?
Hospice or home care, they are community visits, community health?
Yes. Yes.
Oh, okay.
Yes. Okay, let's jump to the next section. Acts and organizations that play a role in public health. Okay, so you need to know what the FMLA is, Family Medical Leave Act. How does it impact communities? Why do nurses choose to be public health nurses, community nurses? Right here, autonomy and independence. Know what Frontier Nursing Services is. And what was their primary focus? Their primary focus was vaccinations. It's right here at the bottom of page 2. Okay, and then this bullet is important. Even though it says 20, I need you to substitute that for 2030 because they are very similar. So you need to find what is the purpose of Healthy People 2030. You can go to the website. How does it impact the objectives of school nursing? Okay, so go to chapter 31 or chapter 31 and find out what the objectives are. Well, the second part of this question is how does the objectives for school nursing, what are the objectives for Healthy People 2030? Go to chapter 31, that's where it's going to be. Okay, and then here, what is the purpose of Healthy People 2030? That's going to be either, it's probably going to be in your chapter 2, but right in your module, or in your syllabus under week 1, after all the reading, after listing chapters, all your chapters, there's a website. It's your link to Healthy People 2030. Okay. Okay, and then what's QSIN? QSIN stands for Quality and Safety Education for Nurses. These are competencies. I think there's 6. What are the main objectives? So that's early on in your book, probably chapter 2. Okay. And what the whole book does is every chapter, it takes one of the QSIN competencies and applies it to that chapter. Really, really informative. I always point that out to my students. We stop at every prevention box, primary, secondary, tertiary. We stop at every Healthy People 2030 box, and then we'll stop at every QSIN box. Those are three good learning activities that are covered on exams in every chapter. Okay. Need to know what CDC is. You need to know what the difference between advocacy and social justice are. Anybody want to take a try at what the difference be without reading this? Anybody want to take a try at what advocacy versus social justice is? Because you need to know this. So we can read it. Advocacy, oh, go ahead.
I say when we advocate as a nurses, we advocate for the patients, right? We advocate when they are in pain. We go and give the medication. If it's something that it doesn't calm down their pain, we talk to the doctor. We are advocating that, right?
Yes. Advocacy is taking actions on behalf of another person. So as nurses, we are an advocate. A lot of our role is an advocate, right? We're speaking on behalf of, we're taking actions on behalf of our clients, right? Nurses may function as advocates for vulnerable populations by working for the passage and implementation of policies that lead to improved public health. Okay, social justice. Go ahead.
I say when we like I work for hospice and home health, you know, and sometimes the patients choose DNR, right?
Right.
So even for the family that they are in so much hard pain, they don't want to let it go their loved ones.
Mhm.
We still advocating for the patient, right?
Right.
His
Right.
rights.
Mhm.
Just
That's
wanna
right.
make sure.
Yeah, thank you for that. That's great. That's good. That's a good assessment. Okay, social justice. Okay. Social justice means justice with respect to the treatment of more advantaged versus less advantaged socioeconomic groups. Okay. Next, what's the primary goal of public health? The prevention of disease and disability. Okay, that's the primary goal of public health. Okay, public health nursing has a population-focused practice. Okay, do you remember population-focused, community-oriented, community-based nursing? So population-focused is public health is focused on the whole population. Okay, so if you're a community nurse in your hometown, you're focused on the whole the population. If you're practicing population-focused nursing, then you're focused on the whole population. Okay, public health nurse works to understand the problems and solutions of a defined population. Maybe they're studying age, gender, race. These are aggregates. Homeless, diabetics, elderly, children. Okay. Public health policies create standards, right, which hopefully decrease the mortality related to communicable diseases. Communicable diseases are a big deal in communities. Okay, the leading cause of mortality has shifted to chronic diseases, such as heart disease and cancer. Why is that? Why is the leading cause of mortality shifted to chronic diseases?
More percentage of people, they die with that.
Okay,
They are leading,
part of it.
well, they are leading because sometimes, you know, it's like, sometimes people, they don't know and find out late, like, you know, it's not good prevention and intervention.
Mhm.
Some people, you know,
Mhm.
or,
What about people
Or
living
what-
living longer?
yeah, people living longer, like, you know, it's like, probably it can work with the socioeconomic, probably if they have ability to have somebody, some nutrition that provide the health care, you know,
Mhm.
and that's why, and they prevent all diseases, illness, you know, and
Mhm.
they were able to live longer.
Exactly.
Or they environment too, you know, they live in the farm probably, you know, it's no much pollution,
Mhm.
and so things like that.
That's excellent. Thank you. The increase in the number of older adults, people living longer, an increasing population has created a huge challenge for public health nurses. So that's one of the biggest challenges for public health nurses right now is the aging population, because there's so many chronic diseases. Okay. And then anybody know why the population, the two biggest factors of why the population of the world is increasing? Do you know what that's due to?
Fertility rate.
Pardon me?
Fertility rate.
Mm-hmm. Mm-hmm.
Like,
And
that
then
means like OB doesn't have a nurses, obstetrics, we don't have a good teaching, so that they have like more babies, like,
Mhm.
you know, like they say,
right.
how they say, prevention of education, sexual education,
Mhm.
like in teenagers especially, you know, if
Well,
we
that's
don't
part of
teach,
that's part of the increased fertility rates, but also the second
Yes.
reason is decreased mortality rates. We just touched upon this. People are living longer due to advances in healthcare, vaccinations, screenings, medications, technology, right?
Yes.
All right, let's go to the next section, management of care across the lifespan. This first bullet is important. Unless a patient a client is declared incompetent, the patient should have the right to, we call it self-determination, which includes managing their own decisions, finances. Okay. Review your ethical principles, your principles of non-malfeasance. Okay. Your principles of beneficence. Okay. Review those. Okay. What are the goals for, somebody who is competent? Okay. What are the goals? What are our goals for caring for somebody who's elderly and competent? Here's what our goals are. They're right here. They're listed right here. Maximizing self-care capacity. You need to know these. Managing chronic diseases effectively. Preventing complications. It's all right here. Delaying deterioration or decline. And achieving the highest possible quality of life before dying with comfort, peace, and dignity. What can we not do? What is impossible to do with this client?
Put them in a nursing home?
We can do that. What can't we do?
what we can do is
And what we can't
will-
do.
we will try to promote and promote the patient to cover their needs, like
Right.
make sure like the patient is able to eat,
Mhm.
walk, you know.
Yep, we just went through that and all.
Improve.
We just went through all that here, but what can we not do? I'll give you the answer.
What
We cannot prevent death. Right?
Oh yeah.
But we cannot prevent, we need to do everything we can to help them with self-care, help them manage their chronic disease, you know, die with comfort, peace, and dignity. But we cannot prevent death. Okay? Okay, so the primary focus is, do you guys remember the difference between community-based nursing and community-oriented nursing? I think of it as community-oriented. I just think of that as big picture. We're orienting ourselves to the community. What does your community look like? What are the risks? What are the health needs? Kind of a general community assessment. Where community-based is you're already in the community. You're based in the community, working with clients, ill clients. So that's a difference. Does everybody understand that? So oriented is the big picture. You're focused on the community as a whole, health promotion, health needs, health risks. We're community-based. I think of it as you're already based in the community, working with the ill population. Okay, so we just went through this. Community-based nursing's actions include managing chronic conditions and involving individuals in their decision-making. Primary focus of community-oriented is to focus on the healthcare of individuals, families, and communities. So a nurse who's demonstrating community-oriented nursing evaluates the risks of individuals, families, and groups. Just talked about that. And then we already mentioned this, population-focused practice, improving the health of populations in addition to having effect on the individual. Okay? So do you understand how this is set up? This study guide. Next section is school nursing. Very self-explanatory. Here, review the Healthy People 2030 objectives for school nursing. Okay, so go to your chapter 31, find your Healthy People 2030 box and review the Healthy People 2030 objectives. Remember, when you get a Healthy People 2030 question on the exam, it only what's in those boxes can be the correct answer. Your other answers may seem like a good idea. Let's say our Healthy People 2030 goal was to reduce childhood obesity. Yep, that's an objective. But let's say let's say a question had the other answers of, you know, increased vaccination rates. If that increased vaccination rates answer is not in your Healthy People 2030 box, it's not the right answer. It may sound good, but they can't address everything. Does that make sense? Make sure it's in the Healthy People 2030 box. Okay? Okay, remember, let's say in the schools, if you're presented with a whole bunch of scenarios of kids, somebody needs a medication, somebody needs a Band-Aid, somebody needs an ice pack, somebody with asthma comes in and needs an inhaler. You have to prioritize which kid are you going to see first. All right. Okay, who takes priority?
ABC.
Right, remember ABC. Yep. Okay, so physical takes precedence over psychological. And then here's some, how do you manage symptoms of conjunctivitis? How do you manage hand washing? Warm compresses to affected areas, not cold, warm. Okay, and then this last bullet's about school interventions. Lots of school interventions are aimed at preventing violence. Okay, and this bullet goes through what steps can we take to prevent violence? Okay, such as engaging parents in school activities, foster communication, problem solving, limit setting, supporting the school in creating policies, zero tolerance for weapons on school property. Okay. Next section, family assessment, home visits, interventions, primary, secondary, tertiary. Okay. What's a crisis? What's a family in crisis? Family in crisis occurs when the family is not able to cope with the event, becomes disorganized or dysfunctional. When the demands of the situation exceed the resources of the family's in crisis. What's the difference between a genogram and an Ecomap? We reviewed that in week 2. Anybody know the difference? Need to know it. Okay, so a genogram, right, is a genetic information, right? So you're going back and doing a health history for 3 generations. What conditions did loved ones have? What did they die of? Cancer, cardiac, substance abuse. Okay. So genograms can be helpful and give healthcare providers tools they need to use a person's unique genetic information to prescribe the most effective treatment. Are you going to be predisposed to certain conditions that, based on knowing your family history, would help your healthcare provider treat you? And then ecomaps are about relationships, social relationships. How is the client, whether it's individual, family, community, what are their relationships with the community, right? Do they have relatives? Do they have neighbors? What are their family connections? They go to church, kids go to school, right? Because we want families connected in with the community, right? So an Ecomap right here, down here, represents the family's interactions with other groups and organizations. Okay, understand why home visits are the best assessment, right? Why are home visits the best source of doing an assessment? Because you can do a physical assessment, psychological assessment, safety assessment, environmental assessment, right? How is that family functioning? Okay. Let's jump to vulnerable populations. Okay, this whole class, this whole term is based on vulnerable populations, or most of it. So we need to understand our vulnerable populations, right? What is vulnerability? It means you have an increased risk of developing adverse outcomes, right? Lots of, who are some vulnerable populations?
Homeless, elderly,
Children. Youth.
You guys just did a paper on, you just did a discussion question on this. Children, disabled, right? Poverty, this is what we need to know, this right here. If you're asked, what is the primary cause of vulnerability? Here's your answer, poverty. Okay? Poverty is a primary cause of vulnerability, and it's a growing problem. Okay? And don't just, I'm kind of skipping through here. There's more information in here, so don't take just what I'm saying and that's your review. I'm just trying to review it with you. Okay, you need to go back and go through it. Here's another pretty significant statement. The aging population is the greatest challenge for public health nurses. Okay. Here, this is about primary, secondary, and tertiary. Okay, I'm gonna have you read that. Primary is giving a flu vaccine. We're trying to prevent from getting the flu. Secondary is screening. Okay. Tertiary is conducting a group therapy with residents that have a diagnosis of being mentally ill. So this is really good. Good summary. Okay. And then this next bullet is about when you're intervening with a vulnerable population. Here's some guidelines. Set goals, set reasonable goals based on the baseline data you collected. Set goals collaboratively with the client. Focus on teaching. There's a whole bunch of information in this paragraph. So if you get maybe a select all that apply, you need to be aware of all of them. For example, teach homeless individuals how to read their own TB skin test. Give them a self-addressed stamped card they can return. Okay, so services that have an increased impact on the population include those that focus on socioeconomic determinants. Okay, and that's poverty reduction and improved education. Okay, so if you're asked about what kind of services have the biggest increased impact on the population? Okay. Okay, so services would be, how do we reduce poverty? How do we improve education? Okay. Then last is evidence-based practice. What's evidence-based practice? We do it all the time. You're all doing it in your current jobs. What do you do? What's evidence-based practice? Evidence-based practice is using the most up-to-date current evidence, research, and to improve your practice. Okay, so evidence-based practice represents a cultural change in practice, right? It provides an environment to both improve both nursing practice and client outcomes. So that means if you're working with kids with asthma, I was working with kids in asthma in the schools, we would always look at our nursing journals for new research, new articles, new updates on better ways to manage our kids with asthma or manage our kids with diabetes. You're always wanting to improve your nursing practice to hopefully improve client outcomes. And that's evidence-based practice. Okay. It can be hard because does anybody work with anybody that anything related to change, they go, nope, not interested. Just keep it the same way. Anybody work with people like that? Those are people that really are not into evidence-based practice, but you need to help them along because evidence-based practice is now best practice. Okay, and here's some barriers for evidence-based practice. People unwilling to embrace new knowledge, right? So anyway, but evidence-based practice is best practice. So that's the study guide in a nutshell. Let's move on from the discussion of 5th edition versus 6th edition. We are teaching from the 6th edition. And for those of you that missed the first part of the class, I've already gave you the chapters. I've already converted the chapters for you and given you the edition 6 chapters that are equivalent to weeks 1 and 2. Okay, for those of you that haven't put your,
I have a question.
hang on. For those of you that haven't put your name and your professor in the chat, please do that. Go ahead, Cassie.
Now, is this the class that I need the maternity book for also? No? Okay.
There's only
Okay.
one. It's only one book.
Okay.
I have a question.
Yep.
I missed the chapters for the very first section. Could you just tell me what those are again? For the priority.
Chapter week 1 is chapters 2, 3, 9, 23, and 31.
Okay.
Week 2, no,
No, I got that part. Remember when you were
Oh.
going over which chapters were covered by each section
Oh,
of the study
which one?
guide?
Yep, which one do you want to know?
Just the very first one, the priority and safety assessment, key concepts using ADPI.
That's kind of that's an introduction. That's really doesn't have, that's all over the place.
Oh,
It's
okay.
it's
All right.
reviewing ADPI levels of prevention and safety. So I really
Okay.
don't associate that with a specific chapter.
Okay,
It's
I just
kind of
thought I
keep,
missed it.
yeah, no, good question, good question.
Okay, thank you.
So everybody put their name in the chat, please, and who your professor is. I want to give you credit for attending today. Anybody have any questions? I hope this was this helpful?
Yes, it was.
Yeah, thank you.
You're
Yeah.
welcome.
I have a question. What chapter is family assessment, home visits, and intervention, please?
Family development and family nursing assessment, chapter 20.
Professor, so definitely totally ignore the 2020. Just
Yeah,
focus
yeah.
on the 2030 box, right?
2030. Yep, we're in edition 6 now. No more 2020. Okay,
Okay,
in fact,
perfect. Thank
going,
you.
yep, going forward, you won't even hear 2020 mentioned. It's all 2030. Okay,
Perfect. Thank you, Professor.
you're
you,
welcome.
Professor.
Good
Good
night.
luck. Good luck in your
Thank you.
exam.
Thank you, Professor.
Thank you.
You're welcome.
Thank
You're
you.
welcome.
Thank you. Have a great weekend.
Oh, you too. Thank you.
Now we have class at 8, right?
I'm sorry.
We have class at 8, right?
Yes, but not with me.
Oh, not with you though?
No, what class are you in, Cassie?
Let me,
I
This is
Uh,
for community, isn't it?
yeah, it's